President, thank you very much. I appreciate an opportunity to speak on a bill we passed out of here yesterday, the Veterans Access Reform Bill. We passed it 93-3, which is an amazing thing when you think about it. In this body, as we struggle to get issues in front of us, to work on it, what we saw was an incredible bipartisan piece of legislation, basically saying we are for vets. We want to make sure veterans have the best care that they deserve, they earned, fighting wars, not only the recent ones, but in past. When you look at the piece of legislation, and I want to talk a little bit about the piece of legislation, then I'm going to talk about some pieces that are important to Alaska, and I'll show some examples here in a second. But I also then want to talk about what's still ahead of us. As a member of the Veterans Committee, it's not just about passing one bill and saying we're done, we're completed, we've done our chore, we've done our job. No, there's a lot more work ahead of us. This bill that we passed, again, a bipartisan bill, Democrats, Republicans coming together, because veterans is not a partisan issue. It's an American issue. In my state, American Alaskan issue. Your state, a Massachusetts issue. It's important for all of us to step up to the plate and make sure we do the right thing. This now provides the VA Secretary the authority to dismiss those senior executives that aren't performing, aren't doing the job. But also it ensures that if there are situations, as we've heard and seen and been shown to us, that there are people who falsify data, then they're going to be held accountable. And as you know, recently we've heard the FBI now is reviewing some of those situations. Whoever's at fault and has done anything to falsify needs to be held accountable and brought to justice. But it also brings out an issue that we have been doing in Alaska for several years. An issue that when I ran for office, I remember I called the Heroes Health Card, because I thought it was important, no matter where you are as a veteran, you should be able to go and access health care all throughout Alaska. And as Mr. President, you know, my state's a very rural state, very vast in its size, and where people are and where they live is not easy to describe until you see it or be there. And, you know, just for example, here in Anchorage, flying up here to Barrow is 700 miles. Long distance. But if you lived in Barrow and you're a veteran, you couldn't get health care there, a VA facility. It didn't exist. You had to come down here to Anchorage, that's just for a clinic, because we don't have a hospital, a VA hospital in Alaska. So then if you needed hospital services, you would have to go to Seattle. Long distances. So for several years, we worked on this issue, and I continue to push. I brought General Shinseki out, Secretary Shinseki out to Alaska, to rural Alaska, to show him the impact of veterans who lived in rural Alaska, but yet across the street, medical services provided by the Indian Health Services through our native health clinics were being delivered by our tribes. Incredible health care, but veterans could not utilize it. So I try to show him that the care there is incredible, high quality. We need to be able to access this. It's all paid with federal dollars, so why not figure out how to access it? Why not figure out how to maximize our public resources for the betterment of not only our Alaska Natives, but also our veterans in Alaska? So we worked on an idea that today we have now agreements with 26 plus tribes. All these black dots on this map show all the new areas that veterans can access health care if they want. It's just another choice. It's not a requirement, but if they want to stay in their region, stay closer to their home, be part of their own healthcare system there, they can, and the VA will reimburse them, reimburse the clinic. So it's no money out of the pocket for the Indian Health Services or our tribes that deliver health care. For example, in Nome, I was very proud when we debated a big issue a few years ago, is trying to figure out how to deal with the stimulus bill and how to bring economic revival to our economy. And one of those in that bill that I voted for brought a new hospital to Nome, Alaska, run by a tribe, $170 million hospital. But again, 800 veterans in Nome, Alaska could not access that hospital. They still had to fly to Anchorage or Seattle. But now, those 800 veterans, native or non-native, can access that hospital, get care, and end up staying closer to home. All throughout Alaska now, people can access Indian Health Services run by our tribes and delivering incredible services. Along with that, in Anchorage, we have a federally qualified health center that now also allows access for our veterans. Again, the bill we passed, the Veterans Access Reform Bill, took some of these examples that we have been doing in Alaska and showing great success, not perfect, but improving. And give you an example of this next item. And these numbers fluctuate a little bit, but I want to give you a general understanding of where we were and where we are. Before we had all this integrated system with the Indian tribal system within Alaska, the Alaska tribal system, and delivering health care, it used to be 1,000 people, almost 1,000 people on the waiting list. Today, a few dozen, and this changes, this fluctuates, don't get me wrong. So when people call me and say, oh, it's not 10, it's 50 or it's 5, it does fluctuate, but it's no longer the 1,000. And the wait period, the audit that was just done, as we all know, on 140 facilities that they audited throughout the country, Alaska, our VA, was tied for first in the best response in regards to appointments on the waiting list, because that was a big debate. How to improve people who are on waiting lists, because it is appalling what was happening in Arizona and other places. I've seen the list now. Through this audit, people 1,000, 2,000, in some cases 3,000 on the waiting list, waiting for care. The bill we passed yesterday will help improve that. And the numbers for Alaska show that we have an example, not perfect, but yet improved significantly the care for our veterans. Number one, when it comes to appointments scheduled within 30 days or less. When you look at a couple other pieces, for example, mental health, which is a new issue, growing significantly, new patient mental health average wait time in Alaska is in the top 6%. Again, a great record for us, but we'd love to be number one in that category, to be frank with you, and we're going to continue to strive to do that. But the way we have improved the system was to make sure we had more opportunities to access. The bill we passed yesterday, again, takes some of the great things that we're doing in Alaska to show access. I think this will enhance the capacity for veterans all around the state. This is something that, again, when I campaigned on the Heroes Health Card, I just believed that we had this resource that we could maximize, that we could move forward on, that we could make a difference for our veterans, and we're seeing it. You know, when we look at this issue a year from now, we hope that the model that we've laid out in Alaska is not only in Alaska, but across the country. Now, I will say we need to also keep track, because when you deliver health care through our Indian Health Services programs, in our case, the tribes of Alaska, or through our federally qualified clinics, they can provide the health care per patient at a cheaper rate. And no disrespect to the private doctors that are out there that we do contract with, the VA does, and they're just more expensive because they work in a different model, a different business model. That's understandable. But this is a more cost-effective way. So hopefully, by passing the bill, we don't just say we passed the bill and we're done, but 6 months from now or a year from now, we review the costs of delivering this health care to make sure we're getting the most cost benefit, but also delivering quality care to our veterans no matter where they live. Matter of fact, 25% of veterans live in rural America. And so that means we have to make sure our federally qualified clinics have the right resources they need, so when that veteran walks in that door, they can get the care. I will say in the Anchorage ones, again, Anchorage in this zone, for people who don't know Alaska, the federally clinics there, the one Anchorage Neighborhood Health Center, when you're enrolled as a veteran to utilize that facility for your primary care appointment, almost same day. Most cases, same day service. Incredible. Same thing with our South Central facility, South Central Health Services. These are incredible clinics run by the Alaska Native Tribe in the South Central region. Again, same thing. Same day service if you are on the list. And we want to make sure that's clear, that once you're on the list, you can get pretty good service and really direct service. Now, let me put that aside for a second and just tell a general comment about veterans and veteran services we need. Again, I'm going to leave this up just so people see it, but again, the Veterans Access Reform Bill was just another step for us to improve the services for veterans. This is just one of many things. One thing we did do on healthcare, the president and other members remember when we had the shutdown, government services all stopped, except VA health care, because when I first got here, there was a bill that I co-sponsored that gave advance appropriations. Why was advance appropriations important? So when government shutdowns occur, health care still gets delivered to our veterans. They shouldn't be subjected to the politics of this place, and we made sure of that. But to be frank with you, we still have more work to do. I heard some members come down and they started talking about disability claims, which still is a challenge for us. We still have a lot of work in this area to make sure that we increase the capacity. I know as an appropriator, we put more money into this system so we can have more capacity to shorten the time of disability claims and making sure we get these done in a fast manner. But that we have to keep in mind, if we don't have advanced appropriations on that side of the equation, the benefit side of the VA, and there's government shutdowns, guess what happens? GI benefits stop. Disability payment claims may not be processed timely. Other benefits that individuals receive as a veteran get stopped. So there's a bill pending, which I'm very proud to be one of the prime sponsors on with a Republican and on both the House and Senate. It's a bipartisan bill. Every single group, veteran group, supports it. It's important to improve the delivery system of the benefit side. The health care side, we did some work yesterday. We've been doing work in Alaska for the last few years. Now we need to work on the benefit side. There are many different bills that are out there and a long list of stuff working on homelessness that we need to keep focused on and making sure that our benefits for our GI Bill continues to move forward and helping our veterans. But I want to give you an example of a couple people. And I want to say these case stories, and then I'll end on this, but I think it was important to, again, remind people of the work we did yesterday, the work we have been doing for years in Alaska, the result we're getting, the example this is now woven into the Veterans Access Reform Bill we passed yesterday, and I think Alaska is a great example. But here's a couple cases I've received in Anchorage recently. One Anchorage veteran was in touch with my office, was trying to get help from the VA since 1995 for an undiagnosed condition related to jet fuel exposure. Last week, my office was able to get him an appointment immediately in order to get his service and at least looked at. He called to thank us, and he's getting care, and he now appreciates the appointments and the appointments he needs. But I will say, it is the job of our office, all our offices, as members, to do everything we can for veterans. But we want to make sure this veteran, when they walk into that clinic or facility, they don't have to wait this long, or these situations. Another veteran in Soldotna with a back condition, about 150 miles away from Anchorage, which again is where we have the clinic for the VA, about a 3-hour drive in the mountains, needed to be seen closer to home. Again, our office helped arrange so he can get service right there, so we can get service closer to home. And it's important that we look at these, and I see these examples all the time that we're working on every single day. I run into veterans all across Alaska that thank us for the work we do to make sure they have access and capacity to get their benefits or their health care. Mr. President, I'm going to end by just saying that there's no better job here than working with the veterans. It's something I enjoy. 77,000 veterans in Alaska, the highest per capita in the nation. Every day I run into a veteran that may have an issue or just thanking us for the work or thanking his country for the service of what they get and their benefits they receive. What we did yesterday was an example of what the Senate can do and has done before with veterans. Come together, unified, negotiate, but never forget our principal job here is to take care of the American people as best we can and the services that we should render. And in this case, it was for our veterans. Again, Alaska is an incredible example, not perfect, and let me be clear about that, and the numbers fluctuate, but at the end of the day, the trend lines are the right trend lines. We're moving the right way. And to know that the bill we passed yesterday has some aspects of what we're doing in Alaska put into that bill makes me proud to say that Alaskan veterans should be proud that we not only are doing the best we can, but we're using our examples to help veterans all across this country. And I think that's a great statement. We have more work to do. And it's just an honor to be here and be able to explain once again what we're doing in Alaska, but also knowing that yesterday being able to vote on that piece of legislation, and I know the House bill is very close to ours, we'll have a compromise bill, we'll pass it, and veterans will get better care tomorrow than they got today. Mr. President, I yield the floor.